a lot of people, and before we start our session, let me have a poll and yes. So if you can just answer these questions. So accordingly, I will prepare my uh, examples and my presentation. I'll try to give as many examples as possible from the industry. So people we have manufacturing, we have healthcare also. Okay, logistics, IT, oil and gas. And good news is that I have worked in manufacturing also, I have worked in healthcare also, I have worked in banking also, logistics also, IT also, and I have done so many projects. Now you would say, how is it possible that a person can work in almost all the uh, industries? And that's how Lean and Six Sigma Master Black Belts are. They can improve any quality issues, any quality related problems. They can solve any quality related problems by using Lean and Six Sigma. So thanks a lot for participating in this poll and letting me know that there are almost this time. In fact, I assume that everyone has answered, and I see that almost 60, 50, means equal participation of manufacturing and healthcare. So I'll try to balance my examples. Construction is also there. Okay, fresh students are also there. Okay, so it's a mix, and I'll try to take simple examples, not very industry specific, something which can be correlated, something which can be related to all the industries, different industries. So once again, welcome, and thanks for joining this session. And let me answer, let me ask you one more question, if you can just answer this question as well. Which department, like you are from manufacturing, but which industry you are from? So which department you are from? So what is your domain area? So we have operations, we have quality, and we have got supply chain and IT and HR. Okay, some people from HR also this time. Okay. Oh, wait, okay. So marketing. Oh, I have done programs in, I have done projects in HR also, marketing also. If you have time, a little bit extra time towards the end of the session, I'll be happy to share some of the projects done in different industries. But yeah, I'll take you through the session by doing a project. We will all do a project. We'll together do a project, or almost, and I can't say we'll together do a project. I will do a project with means I'll do a project in front of you. And when you join my green belt and black belt sessions, of course, we do the project together. So these projects are again based on the real data. And once again, thanks a lot for participating in this poll. And let us go to the next poll. So if you can just increase the people who are seeing this poll, if they can increase the window size, they can see the full range of salaries, and this will tell me that how much percentage increase you can expect if you are a Lean Six Sigma Green Belt or Black Belt certified. And we guarantee that we'll ensure that you become a green belt and a black belt certified. Used to be, but yeah, today you'll be yellow belt. Yeah, today you'll be yellow belt certification you will be getting, and in advance I can congratulate you for that. But you have to attend the full program. You have to also follow some instructions. It is no fee. There is no fee for that. But yeah, you have to appear for, you have to just answer 5 questions towards the end of the session. And if you're attentive during the whole session, you will be able to answer these questions. So once again, welcome to the training program. Okay, next. So we have almost finished the polling, and thanks a lot. And now I have made a little bit of changes in the agenda based on whatever you have given me as a feedback. I see that a lot of people who are in the first salary range, which was mentioned, In fact, you will easily 30 to 40% increase in your salary. Easily you can get. That is something like I can promise you after you get a black belt certification. And for the remaining, it ranges from 20% to 30%, or sometimes 15 to 20%. So you're at a very high salary already, then increment to increase would be around 20%. Okay, we'll be introducing you to the company. Then I'll take you through the what is Lean and Six Sigma, what are the benefits. Then I'll introduce you to the Lean and Six Sigma, and also introduce you to DMAC, Define, Measure, Analyze, Improve, DMAC cycle. And if you are a yellow belt, at least you should be definitely knowing about DMAC. So by the end of the session, you will be knowing what exactly is define, measure, analyze, improve, and control phases. What are they and how to apply them to improve any process in any industry. Some of the applications in the industries, I will try to give as many towards the end. If you choose to stay on for half an hour more, then I'll be happy to share more examples, more case study, real life case study. But during the session, I would be just going through the basic. I'll take you through one project. We'll do one project for the next 2 hours. And as we do the project, we'll keep on learning some tools and techniques so that you will get lots and lots of tools, knowledge of tools. Once again, formal welcome to everyone. Okay, so right now, during the COVID, I had made some videos, so let me use them to welcome you. So once again, people are still joining in, I understand. So 5-10 minutes, they will keep joining. So let's wait for them and then I'll start.
Hi, welcome to Anexas. Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you.
So once again, warm welcome to everyone. Now here, I would like to, maybe as we are waiting for everyone, let me introduce you to the organization and also to about me. Also, I'd like to tell a little bit, maybe 5 minutes I'll take for that. So 2006, it was established, and we have been conducting training programs for last around 18 years. And we have trained more than 150,000 people around the world. But I'm Amitabh Saxena. I'm a chemical engineer, MBA finance, and amateur poet also, and also hardworking. I was hardworking earlier, but I was not earning enough money. During 1990 to 2000, I was working in hardcore operations in chemical industries, projects and hardcore operations. And then I found one of the notices in the companies. Read those days, you had notice boards on the companies. I'm talking about back in 1996 or 97. There was a note that we would like to choose the top 10 people in the organization and make them black belts and send them for training. And I thought I was one of the top 10 performers in the company, but unfortunately the company did not think so, and I was not given an opportunity to become the black belt. But the good thing, what I noticed was that these people, the people who attended the training and who did some projects, they were able to improve the processes in the organization. And not only that, they were able to make some monetary impact, positive impact to the organizations. So what I did was I thought that I waited for the next batch, but it never happened. So I went and did it myself. I spent my own money, invested some money. Those days, only few places had this certification. So I traveled and I, got the certification. And then, as I said before you, I'm a Six Sigma Master Black Belt, a data scientist, PMP, CPHQ, and lots of things. And my organizations are more than consulting. I've provided to more than 200 organizations and almost all domains. So I'll be happy to talk about that in great detail in a short while. So I keep presenting in American Society of Quality conferences for the last 10 years. Every year I'm presenting. This year in May, I'm going to San Diego, and I'm presenting on, again, Lean and Six Sigma project. So some of the cases, that this one is about healthcare. Last year I presented on manufacturing. Last year I presented on banking. And before that, 4 years ago, on rig move in oil and gas. And before that, I presented a project on logistics. So I've got many case studies and a lot of experiences. And why I'm telling you all these things, because you too can achieve this and much more, because you will be learning not only from me today, but also from what I have learned from my students. Okay, some of the pictures as we wait for people, some of the pictures where I've done the training programs around the world. I also take pride in telling that I was the first person to conduct the Lean and Six Sigma Black Belt training and certification program in whole of Gulf back in 2007 and 8. That was for engineering companies as well as the hospital. Recently, I conducted one more training for that hospital again after 18 years. Of course, people had changed. It was very emotional moment for me. And again, Europe, I'm already, although I'm a resident of Australia, but most of the time I'm roaming around the world. And there some awards in different forums, appeared on TV shows and multiple
Hi, I'm Shekhar Suman, and I wish to
channels.
congratulate all the Six Sigma certified black belt
We
from
had a very
Anexas. All the
nice
best.
2-3 episodes of Process Excellence, speaker and
On 21st
so
of
now I
May
think people I have
2019, I'm going to speak in
people
American.
have joined lots of Saudi Arabian railways, American railways, Indian railways. They are all our clients. I keep writing articles, Gulf News, Times of India, Dainik Bhaskar, Deputy Health Minister of Saudi Arabia, Dr. Tarif Alama, has few words about this. And about we have trained the Ministry of Health in Saudi
We have
Arabia. More than
Dr. Tarif
500 doctors
Alama
have
with
been,
us,
and
Deputy
Dr.
Minister
Muhammad Abdul Ali, including his
Health
whole
in Saudi Arabia.
team, they have also attended our training. So now let us look at Lean and Six Sigma benefits. I have told a lot about myself, and the purpose was here to tell you that Lean and Six Sigma is applicable to all industries. I have done Aramco, ADNOC, Oman Oil, and King Fahd Medical City, Beijing Hospital, Bangkok Hospital, Apollo Hospital, the Sakra Hospital, you know, logistics, Nakel. We have got Warner Brothers, Ferrari World, and so on and so forth. So lots and lots and lots of. Now you tell me, what are the similar things you notice here? A manufacturing company improves production by 30%. A hospital reduces discharge time of patients from 3 hours to 15 minutes. 64% reduction in recruitment time in a multinational company. And hotel improves customer experience and increases bookings to almost 2 times. A bank reduces errors and cycle times by 80% with enhanced CSAT, and insurance claims time reduced by 70%. So what are the similarities? What is the common? Yes, you can write in the chat box. I would like to see some interaction. Yes, so I see a lot of people are talking about, they're all about improvements. Yes, they're all about improvements. And I hope, yes, you guessed it. Some of you even guessed that they are all Lean and Six Sigma projects. Yeah. And yes, you're right. You're right. So it all reduces the cycle times, it reduces the errors. And also each and every project saves lots of money. And that's what a lot of clients have achieved through our services. So what does Lean and Six Sigma do in short? It reduces the cost, reduces the defects, reduces the errors. And by the way, let me talk about, let me use a little bit of, if you allow me, I will just use a little bit of video so that you will be able. Hi. see that when you join our training programs, you also get videos. You also get live program with the videos. So whatever you see, whatever I covered in the class, everything is available, very much available in the videos. So when you join our sessions anytime, you are having a lifelong association with us. Okay, so now I was just talking about this. I was in the slides.
Done in various organizations. So, what does Lean and Six Sigma bring it for you? Lean and Six Sigma reduces the costs, reduces the defects, wastes, rework, cycle times in a company. It also improves the quality, production efficiency, productivity, customer satisfaction, capacity, profitability, and resilience. And which CEO would not love a person who can help the company achieve all these things? So, well, Lean and Six Sigma green belts and black belts are those individuals who can do improvement projects in the organization by choosing improvement opportunities and converting these improvement opportunities into projects. It all started in Motorola when Bob Galvin, the CEO, took a challenge saying that I would like to improve everything by 5 times in the organization. And he was told about some statistical tools and techniques which Bill Smith and Michael Harry were using to improve the processes. Bob Galvin was so much impressed with what Bill Smith and Michael Harry were doing, he told them to develop a methodology which, if applied to the organizational processes, can improve the processes. So he was particularly impressed with what Bill Smith and Michael Harry were doing. They were choosing improvement project. Now, what is the definition? As I told you, definition of a project is it has a starting point, it has an end point, it doesn't exist after some time. So Bill Smith and Michael Harry would translate the improvement opportunities in the organization to projects, and applying tools and techniques of statistics, they would find the root causes of the problem, and then after solving the root causes of the problem would impact the organizational bottom line. Both of them developed Six Sigma DMAC methodology. They started training the green belts and black belts. Green belts and black belts were the people who could fight all the quality related problems in the organizations. Six Sigma brought in a lot of benefits for Motorola, and it also won Malcolm Baldrige Award in 1988. Jack Welch of GE was so much impressed with this methodology that he told his employees that you would not be promoted if you are not a green belt. So everyone wanted to be a green belt, everyone started doing projects. Then GE started telling their vendors and suppliers that if you want to have business from GE, you need to implement Six Sigma. So vendors also started asking what is Six Sigma, and GE would say that we will send our master black belts and train you in this methodology. So in this manner, Lean Six Sigma spread out around the world, and today, almost 80% of the Fortune 100 companies and many, many more companies around the world have implemented Six Sigma and Lean. Lean started in Toyota. I will tell you the story of Lean a little later on. Now let us look at the overview of DMAIC.
Okay, so that was about the history. I just borrowed my own video because I had to make certain adjustments. My team was telling the light is not there. Anyway, today I'm traveling, and the place where I am in, there's a little bit less lighting, but otherwise I look better. Okay, now let us see what is Lean and Six Sigma. Lean and Six Sigma is about, so some people, what I'll tell, some people, they ask, the first question they ask, what is Lean? What is Six Sigma? Of course, you'll understand the real Lean and real Six Sigma after 2 hours, or now I would say after 1 hour 40 minutes or so. But before that, always it's customary to introduce the topic. So if you ask me, tell me in just 2 words, or not 2 words, 2 sentences, what is Lean and what is Six Sigma? So what would I say? Lean is about mapping the process as is and identifying the waste in the system and reduce the cycle times and also reduce the errors by using mistake-proofing methods. This is Lean, a short definition. Now you'll understand everything about Lean, not everything about Lean, but you will understand a lot about Lean after the end of the session. But before that, let me also give you a definition of what is Six Sigma. Six Sigma is about reducing the variation in the process so that your products or services are not having too much of variation and they don't go above the customer's specification limits. Means reducing the defects in the process, whatever the customer feels like a defect, whatever customer doesn't like that we define as a defect. So reducing the defects in the process so that you are able to satisfy the customer to the maximum extent, sometimes to the level of 99 or 99.99996%. Now these are all theoretical numbers. Lean and Six Sigma is much beyond that. Lean and Six Sigma, if you ask me, now if this is my definition, both Lean and Six Sigma is project's approach towards process improvement. What does it mean? The basic definition of a project is that it is a starting point, it has an end point. It doesn't exist after some time. It's a one-time endeavor. So Lean and Six Sigma is an approach where you take up improvement opportunities. You convert the improvement opportunities in your organization to projects, okay, and allocate these projects to people called green belts and black belts because they have been trained in the DMAC methodology, and they can do these projects and they can bring excellent benefits to the organization. So that is what Lean and Six Sigma does. And also, more importantly, Lean and Six Sigma saves money for the organization. Organization is able to show very easily the return on investment. So when multiple projects are done in the organizations by these green belts and black belts, you can see millions of savings in the organizations. That's why Lean and Six Sigma, green belts and black belts are loved by everyone. Of course, yellow belts are also loved, but not so much. But well, you are at the first stage, and why not? Now I will explain this in more detail. The left side, what you see here, what is Lean, and what is on the right side, I will explain. The left side takes a little less time to explain. I'll spend around 10 to 15 minutes on that. And the right side of it, it requires a little bit of basic understanding of statistics. And I am assuming that you are prepared to learn a little bit of basic statistics today. Because once you understand that part, and I'll be slow when I go to that second half, I'll be a little slow. But when you understand that, your eyes will open to a new world. A lot of things are there in your organization. Every machine has a voice. Every process has a voice. Every software has a voice. Every service has a voice. If you're in a hospital, your patient discharge process has a voice. How to listen to that voice and how to manage your processes with a statistical approach. You're going to learn that today. And let us start. The first, I see lots of people from healthcare, so let me make them happy a little bit. After that, I'll take manufacturing example. And after that, I will take a combined example. We will do together, we will do a project. Yeah, we will do a project. So I told you that Lean and Six Sigma is about projects. Lean and Six Sigma is about doing projects. Whatever the organization wants, convert that improvement opportunity into a project. So today, we'll be doing recruitment cycle time reduction project. So an organization wants to reduce the recruitment cycle time. It's like long time to recruit the people. There's a loss of productivity, and in case your organization is billing the employees as well, then it's a total loss of revenue as well. So they want to reduce recruitment cycle time. So we will be doing that project. I'll be doing that project, and you'll be observing. Because as a yellow belt, you don't have to struggle too much. You have to just listen. You have to just understand some basic concepts. That's it. In fact, if you are interested, I will also go deeper into some more statistical tools, and I'll keep checking with you, how comfortable you are, because in 2 hours time, sometimes it becomes too overwhelming to cover those topics, but I'll try my best. Okay, so first let us start with Lean. But before that, let me also explain who are yellow belts, green belts, black belts, and master black belts. Towards the end of the session, I'll be telling you the roadmap of how Lean and Six Sigma is implemented in the organization, etc., because it requires a little bit of good explanation there. But today, because being a yellow belt, you don't have to really go too much in detail in that. You have to just learn some basic tools and techniques. So it is good enough to understand who's a yellow belt, green belt, black belt, and master black belts. But in short, when we implement Lean and Six Sigma in an organization in a right way, there are many ways to implement. But in the right way, if you're implementing, I would train the senior management in Lean and Six Sigma basics. We call it a sponsors training or a champions training. And once they know what Lean Six Sigma is capable of, then they nominate their green belts and black belts, the best performers in the organization. They nominate them for these trainings, and these people undergo the basic tools and techniques training of Lean and Six Sigma, and they are capable of doing the projects. And now the senior managers, they also choose some improvement projects which are going to have a strategic impact on the organization. So that's how Lean and Six Sigma is rolled out. Yellow belts are the people who know the basic concepts, but they can't do the project. Green belts are the ones who can do the projects, who can make a positive difference in the organization by saving money, reducing the cycle times, reducing the costs, reducing the errors and defects. And same is true with the black belt. They can do bigger projects, cutting across multiple domains, cutting across multiple domains. They also undergo a little bit of statistical training, which is a little bit more stringent in nature, and they are capable of solving any problem in any industry. Yeah, so in fact, both green and black belt are able to solve this problems, but black belts can solve multiple problems with bigger Y or CTQ. So I will tell you what is a CTQ in a short while. And master black belts are the people who, like me, who guide green belts and black belts, who conduct the training programs, who guide the green belts and black belts as they do the project. So that's how I've been doing for the last 25 years. So total 33 years of experience. My 25 years have been devoted to Lean and Six Sigma. Well, now let us see what DMAC is. Let us learn, define, measure, analyze, improve, and control. And as I do the project, I will keep on explaining. Okay, I promised you. Okay, well, I promised that before I proceed, I promise that let's make our healthcare participants happy today. We have got lots of healthcare participants, so special welcome to you. And by the way, I am presenting this time in San Diego in American Society of Quality World Conference, which is happening in May. I'm presenting a healthcare project, reducing the nosocomial infections or hospital-acquired infections using Lean and Six Sigma approach, and have really done a real case study I'm presenting, and the whole DMAC project I'm presenting. Once that is done, I'll be happy to put that recording on my Anexas channel, and please watch out. I have a channel called Anexas channel, means we have a channel, of course, it's company's channel, and my projects are put on there. So I'll be definitely just subscribe to that channel, and you'll be able to get lots of information. Lots of videos are there related to Lean and Six Sigma tools and techniques. Not everything can be covered in Yellow Belt, but if you want to learn more, you can always click on, just go to the channel, click on some of the videos. And also one more thing, those who are from India, I have done the whole Green Belt training in Hindi as well. That is also put in on the channel. So if you are interested, you can always have a look at that channel and watch the whole program. Well, now let us see what is Lean. Lean is about reducing the waste in the system. So what is the definition of waste? Well, anything which is not adding any value, that is known as waste. So sorry for jumping the slides. I'll come back to but as I promised to make our healthcare participants a little happy, let me go towards the end. Usually, I have also done projects in the National Healthcare Service in UK. So I'll also talk about it if time permits towards the end. But let us start with the Lean part. So Lean is about first mapping the process as is. And how do you map the process? By going Gemba. Gemba is the Japanese word which means go to the field, go to the place of action, go where the people are actually performing the job. and map the process as it is. As is means the way people are doing the job, and identify the waste. Okay, it's a war on waste. And here lots of waste we are not aware of. We are not talking about the waste which we throw in the dustbin. We're talking about waste in the processes like waiting, transportation, man hours, unutilized or underutilized man hours, equipment, paperwork, etc. There are 7 types of waste: intellect, waste of intellect, waste of scrap, waste of rework, waste of defects in products, waste of waiting, inventory, motion, transportation, overproduction, overprocessing. Now, this is a yellow belt training. You don't have to really master all these definitions. You don't have to really know, but very quickly I'll give some examples, and that should be sufficient for you to understand what I'm trying to say. Waste of intelligence means you hire a PhD person and give him data entry jobs. So you're wasting the intelligence of your own employee. Yeah, you're not listening to the ideas given by the employees. That is waste of intelligence. And to remember that, I usually use I swim too. I for intellect, S for scrap, W for waiting. I swim too. Or in fact, it is Tim Woods. If you interchange that, it becomes Tim Woods. Whatever you prefer, you can use. This is the acronyms, people have designed to remember those 7 or 8 wastes. So rework defects is a waste. You commit a mistake, it's a waste of company's resources. Obviously, it's a waste. Waiting time is a waste. Waiting for other team to complete the job. Inventory, motion. Let me show, because healthcare. Let me show healthcare examples. And there are a lot of hidden ways like overpricing, overtime, overstaffing, insurance reimbursement. So this is Bangkok hospital. Beijing hospital. This Beijing hospital. And we did some case studies there. So let's take an example. Let's map the process of a particular process. Now, those who are not from healthcare industry, don't worry. Don't worry. Don't even worry about the process steps. This is a typical, blood test process. And walking to the outpatient department, it is value added or non-value added? In fact, it is non-value added. So you have to first think about the value from customer's perspective. You have to think about the value from customer's perspective, not from your perspective. Your process may require that step, but definitely the customer is not willing to pay for the step. So customer, if he's not willing to pay for the step, it's a non-value added activity. If you are not doing something right the first time, it is a non-value added activity. And if it is not transitioning the input and bringing it closer to the output, it is a non-value added activity. So waste. In Japanese, we call waste as muda, concept of muda, which came from Toyota. So you see that, finally, what is the value I'm looking at from the blood test? I want to know the status of my health. That is the value. Now, walking to the OPD and registering and all these things you are telling me to all these gymnastics definitely is not going to help me. And I'm not willing to pay for it. That means they are all waste. As a patient, they are all wasteful steps for me. Only value added is drawing the blood and processing the test and giving me the result. That is the value-added step. Remaining are non-value-added steps. Typically, you'll find 80 to 90% of the time in our organizations, I'm talking about all organizations. I just gave a healthcare example, but all organizations is waste. 80% of the nurse calls from inpatients were housekeeping in nature, a survey told. That means it is wastage of nurse's intelligence. My pillow is dirty, my bed cover is dirty. No, nurse is not there to do all these things, but typically that's what happens. And she will forget, to give you medicine or the right dose in case she's busy in all these activities. So it's a waste of her intelligence. There's so many examples. I will just move forward. But using these simple concepts, which I just told you, reducing the waste in the system, reducing the cycle time, we were able to double the cardiology lab capacity from 8 to 16 in one US hospital. We were able to reduce the diagnosis to exam time from 2,000 minutes to 64 minutes in 3 Saudi Arabian hospitals. And then we cut down admission from 17 minutes to 5 minutes in many, many hospitals, and also reduced the signature steps from 18 to 12. In fact, 12 is also high. Approval is the biggest waste in every industry. Approval is not adding any value. Checking, inspection, they are all non-value added activities. So the idea is to reduce the waste as much as possible and create value for the customer. Unnecessary process, motion, unnecessary waiting time, unnecessary transportation error, unnecessary stocks in production, they are all waste. Sorry. Then who could be more wasteful? A person who's underutilized is wasteful. Equipment which is underutilized is a waste. A 5-minute empty walk is a waste. Waste of his talent. Okay. Walk to elevator 1 minute, elevator wait 3 minutes, elevator travel 1 minute, walk to lab or pharmacy 1 minute. Nurse cost per hour, of course, is quite high, and cost of one trip, and then cost of 5 trips per day per nurse. You have 200 nurses multiplied by 365 hours, runs into a few millions of dollars. This is the story of all large hospitals around the world. So much of waste is there in the system. Lab and pharmacy on second floor, radiation equipment on ground floor. Why not they are together? Reduces a lot of waste. Any interruption is a waiting, is a waste. Example of mistake proofing. There's a term in Japanese called pokayoke. Pokayoke means even by mistake, you cannot commit a mistake. It's known as foolproofing. Even a foolish person cannot commit a mistake. Say, for example, you'll not burn the rice. It automatically switches off. That's a mistake proofing device. So you can also use this in multiple industries. If possible, I'll talk about manufacturing industries also. I'll get some examples there also. But manufacturing industry, I'll try to give you more examples from say, statistical perspective. So let me complete this last 2-3 slides on the healthcare, and I'll come back to other industries. Don't worry if you're thinking that this is a healthcare Lean and Six Sigma training. Well, Lean and Six Sigma applies everywhere, and the tools and techniques remain the same. Well, so some of the pokayoke or mistake proofing devices, the machine, it cannot accept the wrong values. Even by mistake, you cannot commit mistake. Oxygen and nitrogen cannot be connected to each other because the connections are different. Well, so so some more examples: fixed number of packages during surgery, complete catheter kits for insertion, and prepackaged medication card with correct dosage so that you don't commit a mistake. Well, now coming back. So let me now go back. Let's go back now. Go back to the initial slide. And I promised about talking about Six Sigma too. Okay. So I'll go slow. And before I start doing the project, let me introduce you to some basic concepts of. Now, whatever I'm describing is applied to all logistics, banking, IT, manufacturing, healthcare, everywhere. But I will take simple. Now, I promised manufacturing. There's a lot of people from manufacturing. So let us take. Now, this appears to be a little complicated. This diagram appears to be a little complicated. So let us simplify it. Then we'll come back to this diagram. Okay, let us consider that you are manufacturing chocolates. Okay. Now, one more thing. Let me ask you also one. See, I can teach you some very, very basic, simple tools also today. Or I can deep dive into some a little bit more statistical tools, which may appear to be complicated, but they're not. But that knowledge will really help you. So I'm fine with both. What do you want? To spend more time on simple tools and techniques like the one which I just described, lean waste. This was a simple tool. Or the ones which are a little bit related to mathematics, a little bit of. You don't have to really, if you know just addition, subtraction, multiplication, and division, that's enough. Yeah, a little bit of basic understanding you have, that's enough. So what you want, simple or I would like to see some responses. You want simple or or average, a little bit of statistics you can digest. Okay. So Amit is telling Nika. Oh, okay, I'm seeing some message. And sorry, I did not see earlier. Jerica Washington has told me it reduces harm to people and equipment. Yes, you're right. Yes, when I had asked that question, and okay, relate to engineering construction also. Okay, one of the persons telling, Amrendra is telling that, and I see Santiago is talking about simple as a beginner. Okay, I will keep it simple, but even a beginner can understand everything. That's what I feel. Okay, so let me start with some very basic simple thing. Okay, let us understand the system map. Let us understand rather than taking it to the complicated part. Yeah, let us understand real estate also. Gitu is selling. See, actually, you apply. Okay, so many people from so many industries. Try to imagine your industry. Now I'm drawing a map. Okay, I'm drawing. Imagine your industry. I'll not even talk about the industry. Imagine your company. Okay, your company is engaged in producing some outputs, right? Some outputs. Company is engaged in producing some outputs. Outputs means they are either products or services. If you are a manufacturing company, you are producing products. If you are a service company, you are producing services as an output. So suppose you are a chocolate manufacturing company, you are producing products. And if you're a bank or a hospital, you are providing service. That's the output. This output is a result of lots of steps done again and again and again and again, multiple times during the day or during the week or sometimes during the month. Anything which is done multiple times is known as the process. Anything which is repetitive in nature is known as process. And what is one-time endeavor is known as the project, which I already told you. Now we have an input. We have inputs which are processed through the process steps. Transformed, these inputs are transformed into outputs. So, which industry you would like to take? So, construction, you are talking about the raw materials and constructions, the design, the specifications, they go through the series of steps, and then finally you have a constructed product, what the customer wants. If you are in a hospital, then you have got inputs like patient information and equipment and the knowledge of the staff and the physician, and they go through certain steps, and then you produce an output, which is the treatment. So this is applicable everywhere. This is applicable in each and every case. I hope now you are with me till now. So I started with a simple thing, as many people have requested. No one, in fact, no one told, only one, Ashwini, okay. Little bit of stacks of Anam told that, okay. Catherine also. So I'll also take care of you. You are my customers. So outputs, they go to the customers. Outputs, they go to the customers. Customers, yeah. The customers, they receive the output and give feedback. They give feedback. Yeah. They give feedback to the strategy department or the planning department, the scheduling department, planning or strategy or the governing board. It depends on which process we are talking. So I hope you are imagining about your organization and you are able to correlate what are the inputs, what are the process and process steps, what are the outputs, who are the customers, and what, and they definitely give feedback. You may capture or may not. They're complaining, isn't it? Complaints are also feedback. Okay, and then Based on what the customers are telling about your product or service, now what you're doing, you are telling the suppliers to supply the inputs. Suppliers, it may not be external supplier only, supplier could be internal supplier also. And also the team, the planning team or strategy team will inform the departments to change their policies or procedures or settings of their processes so that customer is always kept happy. Up to here you are with me. We want to make the customer happy. Okay. And customer is looking for value in the output. They are not so much interested in the products or services. They are interested in the value derived from the products or services. Like, for example, in a hospital, the customer is not interested in the treatment. Of course, he is, but real value is improved health. Yeah. Similarly, a car manufacturing company, the customer is not interested in the car. Of course, he is, but he is more interested in the ability to get transported from one place to another place comfortably. Yeah. And if we are talking about Ferrari, then the value is like pride or whatnot. So customer is interested in the value. I hope you are with me till now. Okay. Now, later on, as we do the project, the recruitment project, you remember, I'll take you through some of the steps. One of the first things a Lean and Six Sigma green belt or black belt does is he does a SIPOC, supplier input, process, output, and customer. S for suppliers, I for inputs, P for process, O for outputs, and C for customers. Okay. And this whole thing is known as value stream map, how the value is created in my organization. Value stream map can be created for your department. Value stream map can be created for the whole company. Value stream map can be created for you as an individual. You are also creating value for different customers, family members, your boss, they are all your customers, right? Your friends. And you are also undergoing through a process. There's their inputs. You process them every day. And then you deliver some outputs. You go to the customer, they give you feedback. And then planning is in your mind. Then you make your changes and adjustments based on the feedback. And so on and so forth. Tell the suppliers to give the suppliers. This is individual also, everywhere. This is known as value stream map, given by, in fact, this is known as systems thinking, first given by Edward Deming. Dr. Edward Deming, great quality guru. His quotes are very famous. Some of the quotes are, you cannot improve if you cannot measure. Second quote is very famous, 85% of your problems are in the processes, not in the people. What does it mean? If you want to improve something, don't try to change the people's mindset or change the people. It will not work. The same process will deliver same results with the different people. If you want to make a real difference, you have to change the processes. Changing the process is easy rather than changing the people. Yeah. So that is why I focus on changing the processes. Okay. So value stream map. Now, see, customer is looking at the value, but it's like abstract thing, right? So how will they perceive that value? Through the products and services. And they would be always interested in certain measures. We call them a critical to quality measure, CTQ. Critical to quality measures, CTQ. Measure. Typical measures, always you'll find time is one of the measures, important measures. Errors or defects, they are measures. Cost, plus anything, like if you are producing chocolates, then weight of the chocolates. If you are in a hospital, then infection rate. Yeah. If you are in construction industry, project completion time, which is of course time here. Yeah. So depends which industry you are from. You can have multiple measures which the customers are interested in measuring. And wherever you're not performing well, yeah, you take up an improvement project. So you see that my cycle times are too much. Customers are complaining. You'll take a project to reduce the cycle time. If your errors and defects are too much, you'll take a project there. If your weight variation is too high in your chocolates, you'll take up a project there. Your infection rates are high in the hospital, you'll take up a project there. Whatever you want to improve, take up an improvement project. Okay. Now, because you have told me to start with simple, so I'll complicate matters towards the end. Actually, I was about to complicate it right in the beginning, but thanks for telling me. I sometimes forget, because see, sometimes people who have got too much of experience, they strictly jump. They assume, they start making assumptions that you know too much. But you're right. Based on the customer feedback, I listen to the customer's feedback. Most of you said starting with simple. I think everyone has understood this, right? Any questions you have, let me know. Okay, now let us move on. Let us start doing the project. So I'll describe this normal distribution curve after a while, as I promised. So let us start doing the project. Okay, let us start doing DMAC project. Define, measure, analyze, improve, and control. Define means you define the problem. You write a project charter. You make a goal statement. You identify a team. Then comes measure phase. Measure phase means you collect the data. How are you performing? You present the data to the whole world. Like types of data we learn, normal distribution, control charts. Very little introduction, I will give it to you. Then comes the analyze phase. Are you able to analyze using the data? Make a cause and effect diagram, do a Pareto analysis, box plot, scatter plot. If the time permits, I will talk about all those topics as well. And the improve phase, like brainstorming or FMEA, failure modes of analysis. Now, FMEA I can't cover, but if you are interested in knowing FMEA, failure modes and effects analysis, means imagining how you will fail, and then we prevent the failure. If you are interested in knowing that, please watch my FMEA video. That's there, very much there. You can always watch. My link is already sent. Immediately you can see. So you can store these links for your future learning. It's a very, very powerful tool, first used by Apollo missions to ensure that no failure occurs in the Apollo missions, sending the man on the moon. And, it's now used by every industry to prevent the failures. Then improve phase, brainstorming, etc. And then control phase, if time permits. Pokayoke I already talked about. Yeah, so I think we are good to go there. Now, let us start doing the project I've been talking about. Oh, sorry. I've been talking about for long. We'll do a project. But let me start finally. So this company wants to reduce the recruitment cycle time. Okay. And we will follow DMAC. All projects around the world, they follow DMAC. Simple, standardized way to improve the processes. So if you claim that you are a yellow belt, at least you should know DMAC, and you should be able to give the full form of DMAIC. Define, measure, analyze, improve, and control. Okay, remember. Define phase, you do a SIPOC, you collect the voice of customers and write a project charter. So now, company has decided that we'll do a project. And we have got people assigned as green belts. I'm the master black belt. The process owner, the manager who is the responsible person for that particular process becomes the process owner. And the sponsor of the champion is the person who is the head of the department in whose process we are doing the project. Okay. So now we have formed a team, and now we do a SIPOC. First, we don't bother about the problem. We just look at the process. I told you, Deming said long time ago. Look at the processes. Problems are in the processes, not in the people. No one goes to the office thinking, today I will produce 30 mistakes. No team goes to your, think about your company. If it's a hospital, hospital, bank, bank, IT company, manufacturing company, manufacturing company. Think about your company. No one, let's imagine 100 people are moving in that office, going into the office or a factory or the hospital. Do they think that today's my target is to produce 30 mistakes? I will make 30 mistakes today, definitely. No, no one thinks. But what happens? By the time in the evening they're coming out, they have committed 30 mistakes. And 30, sometimes 30, 31, 32, 29, 25. In fact, you can see there is a band. This band is known as control limit of the process. Now, don't get confused with the word control limit. Sometimes, the statistics is a little confused. Control limit doesn't mean that I need to control the process then. No. Control limits means voice of your process today. How your process is behaving. Okay. So no one does, well, I'm going to today commit 30 mistakes, but they commit. And historically, if you see, daily, they commit between 20 to 40 mistakes, is an average of 30 mistakes or 30 complaints. On an average, look at your data. You'll have an average complaint rate like every day we have 30. I'm taking an example, 30, it could be 300 also, it could be 5 also, it could be 10. But there is a bang. As if your process is designed to produce those mistakes, isn't it? Keep changing the people, but still the process will give you these 20 to 40 mistakes. Yeah. So who's responsible? The process. And who's responsible for the process? The senior managers like you. You are senior manager, by the way. You have got 5 to 6 years of experience, not the workers, not the ground level people. No, they are not responsible. They may be committing mistakes, but they are not responsible. You are responsible. Nurses may commit a mistake, but governing board is responsible. The chocolate factory, there might be weight variation in the chocolates. Operator is not responsible. The manager is responsible. Okay. Please remember. So first, we look at the CPHQ, supplier, input, process, output, and customer. Now, when to make a CPHQ, usually it's easier to go from right to left. Start with customers, identify the customers. We identify the customers, departments, outputs like, recruited employees, the output, and these basic steps. I'll not go into the details of that, but these are the basic steps. So when you join my training program, everyone does a project. I give project to everyone. And when I teach CPHQ, everyone does a CPHQ in their own process. And similarly, we do. It's a very, very entertaining journey. Very slowly we move, take our own time. In Yellow Belt, I'm a little fast sometimes because I need to teach you a lot of tools. Everyone is short of time today. Earlier I used to do it for one day. But people would say, oh my God, too much of time. Who will join such a long session? So what I did based on my experience, because experienced people can deliver things very quickly. So I did that. I compressed the whole program in 2 hours. And you learn lots of tools, techniques, but don't get overwhelmed because there is a video. You can watch this video anytime. Don't even worry. Now, you measure. You measure performance. By the way, let me also tell you one more thing. Measure on the output. I told you output has got product or services, and we have CTQs. I hope you still remember CTQs are the measures. Measure on the output, we also call them as Y. We designate them as Y. And the measures on the processes and the inputs, the measures on the inputs and processes, we designate as X factors. I hope you are not confused. Simple. X factors are inputs and process measures. Not inputs and process, but input and process measures. Output is output measure. I'll give a pause here. I hope you are understanding. I hope you are with me. Yeah. Okay. Now, generally, do you believe that everything can be measured? Do you agree? Everything can be measured. Right, yes or no there? Oh, some people are saying no, some people are saying yes. So those who are saying no, I would like to disagree with you because everything can be measured. And let me tell you how. There are three rules. You cannot improve, you cannot measure, and you can measure everything. And third rule is if you think something cannot be measured, go back to rule number two. Go back to rule number two. That means everything can be measured. Yeah. I hope my speed is okay. I hope you are able to, well, when I'm presenting in my normal session, my speed is like this. I go very slowly. I keep checking with each and every person. Like if, for example, Fatah, Genesis, Jane, I would, take thanks for, I'll not be able to take your names, Bushra, Nilesh, Rentala, Roshan, Anam, very participative, yeah, Santiago. Thanks a lot. You're participating a lot. So right now, because it's a webinar, you may not be able to see everyone's message. And this is more like a one-way communication because of the webinar. And the reason is because you're getting introduced to some topic. You may have a lot of questions, so we generally, generally deliver it this way. But typical training sessions, we keep interacting. Yeah. So, okay, now going back to my speed. Yes. Thanks a lot. I just wanted to, tell you that I can also reduce my speed, but let's go back because I have to deliver lots of things to you. And how can you measure everything? That's the next question is if you think everything can be measured, how can you measure? There are lots of things I cannot measure. So the idea is, the suggestion is that, okay, so some people are telling that services cannot be measured. Okay. Let me tell you, how can you measure services? There are two types of data, continuous data and attribute data. Continuous data has got a unit and a possibility of a decimal place. And typically 30, 40 samples are good enough to talk about whole process, all the process. I'm talking about all the process. Okay. Attribute data is one which has got categories. Okay, let me take help from my younger brother. Younger brother in the sense, 3 years ago, I recorded some sessions. So he's there to help me always, So let me, and these recordings are available in our,
Hospital has been around 5 hours, and that adversely impacts the.
Okay, let me. Yeah. Yeah.
The third rule can be, if you think something cannot be measured, then probably it is attribute data. Now let me tell you, how can you measure anything? There are two types of data, continuous data and attribute data. Continuous data can be represented on a number line. It can have a decimal place. It can also have a unit. Say, for example, age, height. Age is 52.5 years. That's my age. Height, maybe 180.1 centimeters. Cycle time of a process, 3.5 hours. Or procurement time in an organization, 120.3 days. These are all continuous data because they all have a possibility of a decimal, means they can be expressed in decimal points, and also they all have a unit. Now let us talk about attribute data. Attribute data can be expressed in categories, and categories can be counted. Say, for example,
so now what I'm trying to say here is, try to create a category. If you think something is immeasurable, try to create a category, right?
If you want to measure happiness, so easiest way to measure any attribute data is to create a category, and if possible, you can create a binary category. A presence or absence of that attribute can be one of the simplest categories. So if I take the example of happiness, two categories I can create: happy, unhappy. So if I want to increase the happiness in the employees in the organization, then I can always count how many employees are happy. Let's say 60 employees are happy and 40 employees are unhappy. I can express this as proportion. That means proportion of happy employees in my organization is 0.6 and proportion of unhappy employees is 0.4. And it can also be expressed as percentage. Now this proportion or percentage, they don't have a unit. And a count like 60 employees, I can't have 60.1 employees who are happy. So the count will not have any decimal point. So this is what continuous data and attribute data is. It is very important.
So now I hope you understood what I'm trying to say here is that, see, the whole thing which is coming here as a trying to put a measure to something. Now, see, it may not be the perfect measure. I may not agree. I may not agree with the, this kind of measure, but better to measure rather than not measure. Because now I can increase the happiness in my organization from 60% to 80% in the next 3 months. So every project has got a time, Typically, green belt projects are 3 months and black belt projects are 6 months. I can take up a project and I'll find the root causes and I can do a DMAC project. But if I don't measure, then I will just not be able to do anything about it. Yeah, so that's why just there are 2 types of data. Remember that. Okay, I will just remember this part. Later on I will utilize it. Okay? Utilize it to our. We'll learn about that.
Important. Hi.
Now, we'll write a project charter. So now we have put a measure. Our recruitment cycle time is an easy measure. Now we want to reduce the recruitment cycle time. It's a continuous data. Okay. And we'll write a project charter and it is taking 50 days to recruit the people today. And I would like to reduce it to 30 days. Yeah. A SMART goal statement: specific, measurable, achievable, relevant, and time bound. It should have a time. Reducing from 50 days to 30 days by July 20. Okay. And then approximate savings are $300,000 per annum, because I can bill my employees to the client. This is an engineering company, engineering construction company, so they would like to bill the clients, right? So 1 month delay means 1 month of revenue lost. And if there are 300 people, 300 multiplied by 1 month salary, just imagine the billing, not salary, but billing. So this is going to save a lot of money for the company. The measure phase, we now start collecting the data. Now, don't collect the data only on the why. Why is the output? Why is the symptom? When, let's say I have fever, I go to the doctor. Doctor says our symptom is like, fever. And CTQ here is the measure is the temperature. The doctor focuses on my temperature. Doctor doesn't work on the temperature. Doctor tries to find the root cause. And then after collecting some data, blood sample, X-ray, etc., and then after that, doctor tells, oh, you have got this particular problem. That means he will give medicine to the root cause. Similarly, you as a green belt or black belt, when you eventually go, or generally as a green person, black person, we talk about them, they are doctors of the processes. The process owner comes to them saying, well, and I'm having issue, my process is having fever. Fever means symptoms are delays, customer complaints, defects, errors, cost overruns. These are all symptoms that the processes, health of the processes having some issue. Yeah. So now as the green belts and black belts, they are the physicians. They collect the data, make data-oriented decisions. So focus is not on the effects, but on the causes, not on the symptom, but on the problems. So we call this as Y is function of X. Y is affected by X. Don't focus on the results. This is the result. Don't focus on the result. Focus on the X factors, the causes. Result is not in your control. X factors are in your control. Just take care of the X factors. Automatically, the result will come. Result will be delivered to you. The result will be delivered to you by the system which we have created. The system, beautiful system map which we saw. The system will deliver you the results once you take care of your X factors. So focus on the inputs and process measures. Now let us learn some basic statistics. Sorry, you will have to. Yeah. Let me now. Let us. I told you we'll complicate the maths a little bit. Just tolerate. Some people wanted that way, right? So those who are totally, I hope you will be able to understand. But if you are not able to understand the next 10, 15 minutes, because when we talk about Six Sigma or uh, standard deviation, etc., I'll not go into the details of that. I'll give you links. Those who are interested to know further, they can always watch the links. But who can understand at first instance, I will still be a little slow. Okay. So let us take an example that I'm going to explain to you what is normal distribution. So let's take it, let's say recruitment cycle time project. Don't worry. I'm trying to explain some uh, I'm trying to explain some concepts to you. So always there is a voice of customer. Voice of customer means specification limits. Specification limits. Customer tells you the chocolate weight. Let's CTQ is the weight of the chocolate. CTQ is the measure, the output measure. Yeah. CTQ is the chocolate weight should be 100 grams plus minus 5 grams. We call it lower specification limit and upper specification limit is. Hope you are with me. I hope it's not too complicated. Hello. Yeah. I hope you are with me. The weight of the chocolate should be within 95 to 105. Let me depict it here. Okay. 95 grams to 105. Now let us think of three companies. Let us call them a red company, one is a blue company, and one is green company. I just colored them. Red company, blue company, and green company. Now, red company, when I collected the sample, see, every chocolate cannot be of 100 grams. The target is 100 only. Yeah. But every chocolate cannot be. So let's take how red company is producing. Red company is producing like this. Most of the chocolates are 100 grams. But some chocolates are 101 grams, 102 grams, 3 grams, 4 grams, 5 grams, 6 grams. And this type of distribution is prevalent everywhere. You see, if I convert this into a normal distribution, like a probability distribution, this is how we're producing chocolates. Okay. I hope you understood. Are you able to understand this? Keep writing to me. I hope I have not lost you. I hope you are not confused. Yeah. So anything, if you are going beyond 105 or going beyond 95, it is a defect. It is a defect. Okay. Yeah. this red company is producing defects. Yeah, red company is producing defects. Let me color them with red only. Red defects. Now there is another company which is blue company. They're also producing 100, this. Though if they are going up to 103 and they are going to 97, means their process looks like this. Okay. I hope you have understood now. Blue company is better or red company is better? Blue company is producing very few mistakes. Very few chocolates are going. Still they are going. Still they are going. So variation in the weight in blue company is less. It is producing less defects. Less chocolates are going below 95 and less chocolates are going. But there are some chocolates you are losing still. Now let us think of green company. Most of the chocolates still they are 100. But the variation is very, very low, like something like this. They are almost not producing errors. See, this definitely possibility is there. But they're producing very few mistakes. So if red company was producing, let's say, here it is 10% and here it is 10%, total defects in red company were 20% or 20 in 100. Or in 1 million, if I were to present in 1 million, how many defects? 200,000 chocolates in 1 million produced are defective chocolates. Blue chocolates, let's say here 1% here and 1% here. Yeah, blue chocolate is 1% here and 1% here. So they are producing 2 into 1 million again. In 1 million chocolates, we call it as DPMO, defects per million opportunities. DPMO is how much? 20,000 defects per million opportunities. 20,000. I hope you are with me. Yeah. And what about the green? Green defects. Oh, it is 0.0000015 here and 0.0000015. Total 3 defects, 0.000003%. Yeah, 0.00003, like somewhere. 0.000000300 or multiply by 1 million. It is 3 defects in 1 million opportunities. Only 3 defects. Such a process is called great process. 6 sigma process. Six sigma process. Now I'll tell you. It's very difficult to understand in short session what exactly sigma means. But still, I'll try to, those who can understand. As I told you, this next 10-15 minutes are going to be a little statistical in nature. Yeah. Now, one more thing I will tell you before I proceed. I already told these are known as control limits. For red process, these are the control limits. Control limits for red process is 93 and 107. Control limits for green process is, let's say, 98.5 and 101.5. Yeah. And blue process, control limits are around 95 to 100. Yeah. Control limits are actually voice of process. Yeah. So Let us remove the, let us remove this one. Yeah. So let us take one example of rate process. We call this lower control limit and upper control limit. And what was this? LSL, this was lower control limit, lower specification limit and upper specification limit. Specification limits are set by the customers. So I call it as voice of customer. And control limits are determined by your process, how the process is performing. So they are known as voice of process. Now tell me, range of voice of process should be narrower or voice of customer should be narrow? Which one should be less? Voice of process or voice of customer? Which should be less? The band or the range. For a good process, which is what? The voice of process should be narrower? Yes, process should be narrow. So process should be within the customer specification limit. So control limits should always be within the customer specification limit. Control limit should be within the specification. I hope you are still with me. For some, it will be complicated, but yeah, see, by the way, I could have taught you only the easy tools and then come out as a great trainer. I've understood everything. But my dear friend, if you want to improve processes, if you want to make millions of dollars of money for your organizations, you have to study a little bit. But study is not so difficult, my dear friend. Come to my session. Come to my session. You'll learn everything. Now, this was very so-called tough topic, right? I'm trying to explain, but if you have not understood, don't worry. You watch the video again. I guarantee that you will definitely understand. Okay. So now, till now, I have told you specification limit and control limit. Yeah. Right. In the measure phase, we actually measure how we are performing. Are we within the specification limit or are we outside the specification limits? Okay. So first we make a histogram. One more thing, let me tell you, in case if you have digested this much, let me tell you one more thing. And now some of you, as I said, don't drop out, please. Watch the video again, but stay on. Just 5 minutes to go, 5-7 minutes. After that, I'll come back to the very simple technique. Simple. We'll come to the simple techniques. Mr. Gauss, Carl Friedrich Gauss, yeah, he found in 17th and 18th century that most of the processes, they follow normal distribution. This what I drew just now was a normal distribution. All the processes. I just gave an example of your manufacturing chocolate weight. Even your patient discharge time in the hospital is normally distributed. Age of the people who are attending this session is normally distributed. Yeah. Maximum people would be around, average is 35, 40, 45, and 50. 30, 25, and 20. Very few people will be below 20. Very few people are above 50. Yeah. Most of them are between 20 to 50. Yeah. So, you can draw this normal curve, probability curve for every process. Every process of yours follows normal curve. It is known as normal distribution because it is normal to obtain a normal distribution. And Mr. Gauss studied this curve over the period of time, and he found one interesting phenomenon. What is that interesting phenomenon? He found that every process has got average, mean average, and every process has got standard deviation, which can be easily calculated. Now, don't worry about the calculation part. Yeah. Don't worry about the calculation part. If you are still very much interested in calculation, I have derived the standard deviation equation, the equation also. You can watch it later on. I will give you the link. Don't worry. Right now, just be with me, saying that every process I can calculate the average, and every process I can calculate the standard deviation. Yeah. So, for example, if I take my traveling time, if I travel, on an average, I take 30 minutes, and the standard deviation is. And I collected the data. One day I collected 30. I took 31 minutes, 32 minutes to traveling time from my home to office. Let us say 29 minutes, 28 minutes, 27 minutes, 35 minutes. So I calculated average is 30 minutes and standard deviation is 5 minutes. Let us. Now, Mr. Gauss, coming back to Mr. Gauss, he found that all the processes in the world, they have an average. And if you take 30 samples from that process, just 30 is enough. You can calculate the standard deviation and you will find the whole population from where the sample is drawn lies between +3 times the standard deviation and -3 times the standard deviation. This is true for every process in the world. Now, this is surprising, but it's true. Yeah. In my green belt to black belt sessions, I generally collect the data on heights. Then I take average of everyone. Then we calculate the standard deviation. And with +-3 times standard deviation, we can predict about the whole world. Millions and billions of people we can predict about the heights. Very easy. For example, if I want to do it for my traveling time to my home, on an average, I'm taking 30 minutes, 1 sigma, 2 sigma. Here it is -1 sigma, -2 sigma. Okay. Now, what would be the estimated values of 1 time standard deviation if this is 30? 1 + 1 sigma. Sigma is how much? Standard deviation is 5. So 30 + 5, this will be 35. Okay. This will be 35 + 5, 40. This will be 45. Yeah. Last 5 minutes, last 2-3 minutes for the complication. After that, easy things are. Now this is 25. I hope you are with me. Are you with me? Are you understanding why this is 20? This is 50. This is known as lower control limit. This is known as upper control limit. Yeah. And if I draw a control chart of my traveling process, this is the lower control limit and this is the upper control limit. And if I draw so my traveling time will be behaving within these limits. Okay. Done. Now, the same thing, I have done it in, videos are there, So these videos are also there. I'll just maybe play the video for you for all my videos. They are there on the YouTube channel. If you want to watch those, most welcome to watch. So same thing I have told you. Yeah. Let me talk about.
So if you want to change, if you want to make changes, go ahead with it. And your data collection plan should be such that it should be able to gather data about both X factors and the Y factors. Once you have collected the data, then it's time to display the data. We also use descriptive statistics here. So you can use a histogram, you can make a control chart, you can display the data collected as run charts, etc. To give you a little bit idea of what is control chart, let us take a simple example. Suppose I collect the data of my travel time from my home to office every day. And I find that on an average, I'm taking 30 minutes and standard deviation is 5 minutes. And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control So we have two types of variation, common cause variation to 45 minutes. So you can expect me to travel to my office.
I lost you. Where did I break? Up to here?
You can expect me to travel to my office.
Just if my team can guide me. Okay.
To office every day. And I find that on an average, I'm taking 30 minutes and standard deviation is 5 minutes. And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control limit would be minus 3 sigma limits, that will be 15 minutes, and upper control limit would be 45 minutes, that is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home. So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here. So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes.
So here I have made a cause and effect diagram. Whenever you are investigating a cause of a problem. So here traveling time, taking too much time, so I want to reduce it. I am investigating the causes. So first thing is I make a control chart. I make a histogram and a control chart. So that's what happens in measure phase. Okay. So just wanted to tell you about this. Now let us go back to our project. Yeah. So that was, I did not talk only about basic. In fact, I went into a little deep. So in measure phase, you collect the data. In our recruitment cycle time example, we collected the data. We collected the data of some recruitments And here we defined the defect also. What is a defect? Defect is anything which is going beyond any recruitment taking more than 60 days is a defect. So we have 27 defects out of 47. 27 defects out of 47 recruitments. So if we calculate defects per million opportunities, there will be 27 defects divided by 47, which comes to around 627,000 defects per million opportunities, or 62% of the recruitments are taking more time. So in that case, we'll say that our sigma level, now it's not in your syllabus to calculate the sigma level right now, but just to be aware that every quality level is associated with a sigma level. And highest being only 3 defects in 1 million is 6 sigma. So you'll try to make your sigma level higher and higher, right? That's what the aim is. Now we go to the analyze phase. In the analyze phase, we'll do the process door or the data door. Process door will talk about map the process as is, do a Gemba walk and identify the value added or non-value added steps or the wastes in the systems. We already talked about this. In the data door, you make a cause and effect diagram, Pareto chart, and if time permits, I'll talk about box and scatter plots also. In the analyze phase, first you map the process and find which process is having, which step is not adding any value. You can also do something called escape analysis. Okay. Can I eliminate that particular step? Ask these 5 questions on each step. Can I eliminate that step? Can I simplify it? Can I combine it? Can I automate it? Or can I make it parallel? Okay. And then what you do, you make those changes in the process. Okay. Escape technique, I have given a detailed explanation with an example in one video, which I will share in my chat box. Okay. So this is one thing, one way of improvement. Now I'll be just showing you the processes. I'll just show you some of the ways we generally do in as a green belt, black belt, how they do. You learn. See here, you invite the people and you make a cause and effect diagram. Cause and effect diagram is about brainstorming on all the causes based on man-related causes, machine-related causes, method-related causes, measurement-related causes, Mother Nature-related causes. 6 M's technique, as we say: man, machine, material, method, measurement, Mother Nature. There is a cause and effect diagram detailed video also I have done, which I will share in the chat box as well. Okay. Satish is telling hello. Is anything you want to say something? You can write in the chat box. Okay, now, not all the causes are affecting. Some of the causes are affecting more, some of the causes are affecting less. So here we apply Pareto chart. Pareto chart means, Pareto principle was actually Wilfredo Pareto was an Italian economist who found that 80% of the money or the wealth in Italy was with 20% of the people. 80% of the money was with 20% of the people. We call it as 80-20 rule. 80% of the problems are due to 20% of the causes. Okay. So now what we do? We identify which are those 80, which are the 20%, the vital few. So 80% of your delays in recruitment are due to just few causes, maybe 3-4 causes, 20% of the total causes. If you have listed 20 total causes, 20% of 20 is 4. So only 4 are responsible for your 80% of your recruitment's delay. So which are those? What we'll do? We will look at them. So we used a voting technique here. We gave 10 votes to everyone and asked them, please vote as per whatever you think. Distribute your 10 points to these causes, whichever you think are the causes. And people, they gave their votes. We arranged the votes in descending order. You know, highest being these. And we make a Pareto chart. Pareto means it will tell you highest being what. So contribution percentage of the first cause is 21, second cause is 13, 14 causes 15. Now don't worry about the chart right now. I've not taught you how to make a chart, but just understand the concept, right? So maximum, see, 80% of your problems are due to these 4-5 reasons. We will focus on these 4-5 reasons. Now, you might be wondering who will do all these calculations. I'm talking about average, standard deviation, or control chart. Oh, this is not my cup of tea. The good news is everything is easy now. You have softwares. Very easy. What you have to do, just collect the data. Don't have to collect too many samples also, I told you. Just collect few samples. Like, for example, recruitment time baseline. I've collected sample and I'm using Minitab. Now, when you join my green belt and black belt training program, I train you in Minitab from ground zero. I'll tell you where to click, what to click. We also give you the software. It's all included, everything included. Fees is not high. Trust me, the fees is not high. You'll be happy. So what I'll do, average. This is so let us go back to the measure phase. I'll tell Minitab, please make me a histogram. It will do a histogram for me. It will tell me average is how much, 50, standard deviation is 5. It's telling me everything. I'll tell Minitab, please make me control chart. Okay. Okay, sir, I'll do that. And click the right buttons, and later on, if you have Minitab, you can download it from their website also. But if you have, you can do. Otherwise, you can do a slow motion later on and you can watch. Otherwise, if you come to my class, I'll train you on multiple tools, which are very, very useful. So here now I am doing control chart. Please make me control chart. Okay, in my company, on an average, I take 50 days to recruit an employee. It goes from 36 days, varies from 36 days to 64 days. Yeah. It's a snapshot of how my voice of process of recruitment is. This is voice of process. Remember, control limits are voice of process. So control limits, like what process of recruitment is telling, well, I'm going to recruit the employees the way you have trained the people, the way you have designed your templates, the way you interview, the time you take to approval and everything. I'll recruit a person between 36 to 64 days. This is the voice of process. Well, I'm not happy with that. I would like to reduce it. Isn't it? I would like to change the control limits. The idea is to change the control limits. So go back to my example here. 15 minutes to 45 minutes was my traveling time, if you remember. But I want to reduce. I want to reduce it. I want to bring it. My boss tells me, don't take more than 20 minutes. So voice of customer is 20 minutes. I have to change the step, change my control limits within the customer specification limit. And this change requires efforts like these, what I am taking. Six Sigma is it's an effort to change the voice of process. Process will find a new control limit. When we improve, process will find a new control limit, right? Now, when I'm doing, I just told you about the, cause and effect diagram, etc. Yeah, material, method, environment, method, man, machine, material. We brainstorm on all the causes and ask Minitab, okay, please give me the cause and effect diagram also. It will give you. And it will create a cause and effect diagram. These are the causes. Okay, fine. Okay, Minitab, give me Pareto. These are the reasons of my delay. These are my reasons of the delay in the past recruitments. Why it got delayed. Which reason is occurring most? Which reason is occurring less? Okay, Minitab will draw Pareto. It will count. It will count. Can we? So Amit Nigam is asking, what if UCL is equal to LCL? That's a one-sided specification. You are talking about there is no lower control limit. So higher you should do the work within 30 minutes. So then only upper control limit is there, right? In that case, yeah. So I did not talk about it. I hope you got the answer. So Amit was asking that what if there is only one limit or both limits are same. So there's one. It's not control. By the way, control limits. I'm talking specification limits. Don't confuse. Don't confuse. It's a specification limit. Please remember. Yeah, LCL and UCL cannot be same. Why? Because no process can be exactly same. Cannot. Some variation will always be there. Okay. Okay, so Pareto. So I've got a reason. Reasons like Pareto reasons. Pareto on the reasons why I'm making delays. So assessment time, job description not available, approval time. These are the top 4-5 reasons, and I'll start working on. And I'll give suggestions. Okay. Now I've got my top reasons. I'll brainstorm. Okay, I'll brainstorm. By the way, if you are interested in my learning, interactive learning, lifetime association with me, I'm still in touch with my 25-year-old, 25-year-old, means 25 years ago, who I trained so many people. They're all big guys today. Some of them, in fact, 3 or 4 guys are so well known, everyone knows them. Some are ministers, some are many are CEOs. Hundreds of them are CEOs, CXOs, etc. So I'm not short of assignments, by the way, but this is and actually I like talking at the age of 56 also. Still, I am passionate about this. And that is why I find my time to do some little bit of sharing the knowledge. And also running my company, which is like now 35 member team is there supporting us in doing assignments, trainings, etc. So to sustain the team also, because I can enjoy my life now, I can retire. But dil hai ki manta nahi, as they say, right? So my heart says still let me continue. So I keep doing it. Join my sessions, green belt, black belt. By the way, let me complete the improve phase also. So generate and implement the solutions. I'll tell you how to get your certificate also, yellow belt certificate also. So generate your improvements, get the ideas. There are lots of ideas, technique, etc. FMEA. So I'll not be covering all these things today. So lots of good, great idea generation technique. Yeah. And so Edelmari is telling I can get a certificate. Yes. So you can get a free certificate. Only thing is some little bit, you'll have to do some work. Very simple. It's not difficult. I'll tell you. See, what you have to do, whatever tool you like, some tool you must have liked, it could be cause and effect diagram. It could be a histogram. It could be anything. Try to use that tool either in your works or in your day-to-day life. Say, for example, if you like the histogram. So you can say, I collected the age of people, or I took my traveling time, average was this, and I plotted a histogram. This might be a little difficult, but make a cause and effect diagram. These are the causes of my issues. Make a cause and effect diagram simple, and if you make it, make it and post it on social media. Post it on social media and tag me. Tag me on that. It could be tag me or my company, and certificate is yours. Yellow belt certificate. I will send you this certificate to you immediately. And also, LinkedIn, if you are on LinkedIn, just connect with me on LinkedIn. Just follow me on LinkedIn. I can't connect with everyone because 30,000 things are very minimal. So still, there are some left. Some of you I will be able to connect maybe, but just follow me and or connect with me also if you are interested. And then just tag me and uh, I'll send you the certificates for sure. Yeah. It's a world. See, we are all recognized ISSC, CSSC, every certification body recognizes our certificate. AEC Denmark is a very reputed uh, certification body. You'll get the certificate from. You know. So this is like, I just started talking about, we generated solutions for each root cause. We come out with some solutions, implement those solutions. And finally, once we implement those solutions, we are able to sustain the gains and we save a lot of money. Let me show you what is the end result of before and after. This is what every CEO wants to see. What is before and after? Let me make it. Control chart of before and after. Take a little time. Of stages of before and after. Yeah. Oh, sorry. Sorry. Yeah, even commit mistakes. So this is the time is in C25. I put it the wrong. Yeah, so quality tools, control charts, individual charts, and time. Yeah, now it's okay. Yes, got it. We got it. Yeah. Now, this was the earlier control limits. Now my control limits have changed. There's a change in the system. Change in the system, right? And yes, there is an improvement and everyone is happy. So this is how typically a project is done. You can join my sessions and also tell you how to get the certificate. But if you want to know the next dates, I'll be happy to tell my team if you can just share the this thing. Yes. Today I'm not looking smart because the lighting and everything. I'm traveling. Otherwise, put the lights and the coat, tie, etc. It looks smart. Anyway, yeah. So here are the 4 options. You can join my weekdays program. Weekdays means 2 hours in the evening, 2 hours every day in the evening for from Monday to Friday. Or in the morning. So there is another batch in the morning, 2 hours. Or on the for Saudi Arabia, we have Friday batch, Saturday batch, whole day batch, 8 hours, 7 hours. Or for the rest of the world, we have got Saturdays and Sundays. Saturday, Sunday, 7 hours, 7 hours. This is how we do the sessions. So you can join any session, any batch. I'm starting from March 30th. And if you're not free, then April 27th. Special Ramadan batch timing, if you are in Middle East. The Ramadan batch from 10 p.m. to 2 a.m. in the night. Or in KSA time, it's 7:30 a.m. to 11:30 a.m. Our UAE time is 8:30 a.m. to 12:30 p.m. So many people during Ramadan, they want to spend the time, learning. So these are the timings. Yeah. So some of the fees. Now there are further discounts on these fees. Whatever we are mentioning, there are further discounts. The discounted fee also has a discount. So connect with us and click on that link, register, and again, go ahead. Next one. So there are, depending on the which country you are in, we'll tell you in your currency also. Edel Mari is asking, there is a posted training date on March 23rd and 30th. Is it by you? My team can tell me. Is it by us? And if you can tell us, you send us which one, because yeah, some people. So you just tell us. These were the dates actually. The what I mentioned just now. Now, Lean Six are to observe a process of data like and identify potential area of improvement using these. Either you can do, see, there are multiple ways. Whatever today you have learned something, I'm sure. Use that knowledge and on one page, only one page, it can be a PowerPoint presentation. Present something about that. Present using a tool. It could be a cause and effect diagram, or it could be, these are the area of improvements we can have in our company or in our day-to-day life. I applied Lean Six Sigma to reduce my weight. My weight was too much earlier. You see, before and after, there's a huge difference. So I applied DMAC. So think of any, in one page, talk about anything. Whatever you talk about, I will give you this. I'll give you the certificate. Tag me, or tag the company name. And then there's no deadline for that anytime. Do it anytime. And I'll give you the certificate, yellow belt certificate for free. Yeah. So these are some of the, say, so select a process or select a tool, anything. See, in one page, you have to just put one page. It could be 7 wastes, identifying the waste. It could be any one concept. Don't have to do too much. Just one page. Whatever anyone learning, just post it on, create a post on LinkedIn or Facebook or Instagram and share on social media. Submit the proof that you have done it. Submit the proof to us, and you'll receive. I will send you the return mail. We'll send you the certificate. Yeah. So I think it's not that difficult. At least some little bit of work you need to do. Yeah, and you learn when you do the things. Just one page, one PPT, one page, one PPT, one whatever you want. Don't go too much of detail. A simple tool, any tool or improvement opportunity or anything what you learn. Just put what is DMAC, define, measure, analyze. Anything, whatever you learned, anything what appealed to you today. Just put define, measure. DMAC means define, measure. It is about improving a process. That's it. Even if you put that, certificate is yours. Yeah. There are some more free webinars coming up. I also conduct PMP workshops, CPHQ workshops, yellow belt trainings. Yeah. Data science. Paid training of CPHQ. Okay, fine. We'll tell you about it. I'll give you the details. Okay, I'll give you the details. So we'll tell you the cost of the, it depends on, so if you can tell us your location, we'll send you in your currency. How much is the fees? Yeah. Okay, so now coming back, yeah, my team would like to put some, okay. Now, how to do a project, how to launch Lean Six Sigma in an organization. Let me talk about that also. See, first I already told you, but now I'll go into the details now. See, first we identify the projects in the departments. So this is department A, department B, department C, department D. What are the improvement areas? And then we convert into projects. So when you join my Six Sigma training, you don't have to bring a project. I will give you the project. We'll do the project together. I will do the project. You have to be with me. You observe or do it with me. If you do it with me, best learning happens. No one can beat you. Trust me. See, you'll get such a confidence, then you look for opportunities of improvement in your own organization. And if the organization doesn't give you opportunity, you'll find some opportunity somewhere else. Yeah. So generally, when we are doing our Lean Six Sigma formal implementation, we form a steering committee. Now, this is not related to green belt or black belt, but if you are a master black belt, I'm talking from that perspective. You train the champions. They recruit, they appoint black belts and green belts from their own processes. They say, these are the people who need to be trained, and they will take up an improvement project. And master black belts like me, they train these green belts and black belts. So here I'm training one European company in the champions training. We played a game, so just to prove the power of Lean Six Sigma. They got convinced. They were not able to solve a problem. Then after that, they solved the problem using Lean Six Sigma. That they got convinced. Then they appointed the green belts and black belts. Now I'm taking some example of different company, right? So the champions have recruited, like they have nominated the green belts, and they are coming to the session.
Your team name, 1, 2, 3.
It's all enthusiasm, right?
Anti-Buddha. And your slogan, 1, 2, 3. Green air, go. Okay. And your song, 1, 2, 3. Yeah, go.
So, generally teams are there, another team is there. So in the classroom, everyone does a project. 5, 6 people do one project together. And then finally, they present the project to the senior management, like National Healthcare Service in UK. He has did a project and now he's presenting. He has just presented and he got a certificate. He's talking about it.
Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work past 2 years. We've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
Then Bank Muscat also, we have done a lot of projects.
Hi, my name is Rajiv. I work in Bank Muscat.
We've got a lot of videos like that.
And Anexas consultancy led by Amitabh have helped
We
us
did 40 projects
Lean
there.
Six Sigma
We
journey.
helped the company,
So
trans
last 1
company in Saudi Arabia. He was there talking.
My name is Mohammed Al-Bayati. I'm the CEO of NAPL. Through Anexas, Mr. Amitabh has teach me and more than 1,000 employee of NAPL Six Sigma and Lean processes. This affected our bottom lines by millions of riyals, and it is having a big impact in changing our company from a local company to a regional or multinational company. Thanks to Anexas and Mr. Amitabh. Thank you very much.
Okay, so that was about, I'll show you some more applications and some more industry related applications. This is one of the theme park companies, Ferrari World, and another one is.
So I reached out to our operations team, and we headed straight here to Formula Rossa, one of the signature rides here at Ferrari World at Abu Dhabi, and we decided to work on how we could increase the reliability of the time it takes to update our queue time boards, because as you know, every minute that guest waits in a queue line is super important.
We had the brainstorming session with the team, and we went through a few topics, and then we chose the most appropriate one for the course. The chosen topic was Reduce Facilities Management Service Request Closeout Time.
So I was eager to use statistics and data analytics to solve a business challenge. One of the challenges we had is the erosion of the retail per capita spend in Ferrari World Abu Dhabi, and that was my topic.
Well, actually, being an HR professional, recruitment lead time has been always a problem across the board. So taking that subject in specific will help me improve onto the recruitment cycle.
So what we had worked on was redesigning the product launch process, which we've now implemented.
We had a discussion within our team, and the most critical area that we faced was our closing process. So we decided among ourselves that this is the one that we should go for.
Yeah, the course that we did was a week-long online facilitated course. It was fantastic. It showed us the whole methodology behind Lean Six Sigma, and it also provided a various amount of tools that we could be able to use to improve all of the existing processes that we have here in the park.
Well, it was 1 week training. It was very interesting and always energetic in terms of interaction in the class. Every single day has been different, and the knowledge sharing has been remarkable.
This gave us a broader perspective to understand the issues, and it gave us opportunity to do some brainstorming, and we were able to come up with better solutions from a wholesome perspective.
It was a very stimulating experience where we met every day with the colleagues, all very engaged, eager to learn, and keen on and willing to actually pause, step back from their day-to-day work to get some new perspectives. So it was really a refreshing exercise.
When an issue comes to us, we try to think about it from a Lean Six Sigma perspective. We try to define the issue, we make a project charter about it, we try to analyze it. So it has changed the perspective of how we look at issues.
Statistics allowed me to understand the root cause of the problem and come up with the very targeted improvement initiatives that we aim at implementing within the year. So every dirham per cap increase would represent 1 million revenue uplifts in a standard year. So the impact can be significant.
Well, this program is in benefit not just for me as a recruiter, but it helps the whole organization in terms of how we can identify issues, how we can look into problems.
So what's really exciting is that since we completed the course and we implemented all of the changes that we worked through, we have 100% seen a decrease in the time that it takes to upload the queue time boards, which is really cool. And one other really exciting thing is that one of the recommendations that the team and I put forward through in our project, for the project I should say, is that has now been funded through the business. So you'll have to watch this space for more. I can't tell you just yet.
I would say satisfaction, quality, and experience. And I say that because my project was focused on how we can improve the product launch. So we wanted to get customers satisfied and improve the customer experience. And we wanted to improve the quality of the products that we were issuing to guests and the overall process that we had within the business to launch new products.
I would say that it has definitely brought consistency to the team, awesome efficiency for sure. And the only other word I can kind of think of is it's brought alignment, not only alignment within the department, but with all of our.
I see Adil Murray is already registered. Thanks a lot. Well, most welcome.
Rides here, also alignment within the business and even with our competitors. So it's a win-win.
I think the biggest personal improvement is giving a framework for doing process improvements. I've always worked in customer experience, and so we're always looking for new ways to how we can improve the customer experience, but the training is now given a framework.
Okay, so just to tell, some people are asking about the project which you need to submit. Anything, I'll be giving anything, any little bit thing. I'll just, my objective is to give you a certificate, right? But at least something should be visible from Lean Six Sigma, whatever you're posting. If you do that way, I'll appreciate you more. I'll myself write some good sentences about your performance. So let's see how much you learn from this, and please post it. You can just put, it could be a picture, it could be just posting. It could be a posting also, just like simple post without any picture. Just write about it. You learned something. If something you learned about, just write. Yeah. So I hope you liked the training. First of all, I wanted to know a little bit of your opinion. I hope, you understood a little bit of it, maybe. Hopefully. Thanks a lot. People are telling. So, sorry, this is the old one. So thanks a lot. I invite you. I invite all of you to my training programs. Please subscribe to our YouTube channel, Facebook, Instagram, Twitter, LinkedIn. Yeah. So we are not like a very large company, very like I'm talking about, of course, certification companies are large. I know. I'm talking about myself and our like for me. So if you're joining this, if you're registering, you'll be joining my session. Yeah. So there are a lot of, anyway, Anexas is a large company. So, but I'm associated, and if you join this session, you'll be joining my session. So please join my session. Okay, great. So thanks a lot for being there, and